Welcome to BW Conversations. And we're going to start with our first question. What, according to you, is the state of healthcare at the moment in India? And more specifically, what are the three aspects, in your opinion, that can be improved?
So that's obviously a complicated question when you think about the state of healthcare in India. It's a very broad issue, and we have to break it down actually in terms of primary care, secondary care, tertiary care. And then also a lot of what we talk about normally in terms of healthcare is actually really management of diseases. We don't actually talk too much about health, where we talk about the wellness centers and that aspect. So let me cover these 2-3 things in very quickly. India has extremely good talent, extremely good capabilities on the highest end of healthcare, which is typically the tertiary care, what you see in hospitals, whether in the private sector or whether in the government sector. So if you look at in the private sector, where the majority of the investment has been, you have institutions like Medanta, you have other private institutions. These institutions are comparable to the best in the world in terms of the kind of medical care that they can actually deliver. And in many cases, delivering it at 1/10 the cost is what you would find in the West. Even in the government space, you have high-end institutions like you have AIIMS, you have other facilities which are extremely competent doctors, extremely capable kind of care that is delivering. Only issue is that these facilities tend to get overrun with the population and the number of people trying to access these facilities. So they struggle on that account. However, our challenge comes when we look at healthcare. We have a very weak primary healthcare infrastructure, and we haven't actually been able to develop that, largely because the private sector has found that that's not an attractive opportunity for them, and those who have tried in that space have broadly failed to make it a success. And the government maybe hasn't actually looked at investing too much in those areas, although you do have pockets of excellence where these things are happening. But being a state subject, there's a lot of variance in how that has actually played out on the primary care side. And what that means is that the entire burden of primary and secondary care gets shifted to the tertiary care sector. So not only do you have not enough facilities, but you also have overburdening of the right kind of care not getting delivered in the right kind of facility. That's one of the challenges. The second challenge that we have is that you have certain areas where there is excess capacity of healthcare. Primarily in the big cities, you have actually the population to bed ratios are maybe very healthy. But in large parts of the country, whether it is other cities, whether it is tier 2 towns, and of course also in rural parts, you have very poor population to bed or population to doctor ratios. So there's a very vast range of healthcare. You have from the best in the world to absolutely, not sufficient healthcare facilities. That's on the kind of health management, disease management side. On the health and wellness side, we have done actually even less. And we haven't really focused in on what can we do to prevent health. So there's a big push now with Ayushman Bharat, with the kind of focus of the government towards health to actually do this. So that's kind of the overall situation. Now, when you throw today's environment of COVID on top of this, you are actually saying that not even without COVID, we had huge challenges. Now you're overburdening it with a pandemic. So we are at a situation where, the system is extremely stretched, extremely kind of challenged. And this is not something that happened because of COVID this month. This is because of years of investment and focus it takes to actually build up a health system. And frankly, we haven't really done that in India up until this point.
Since you spoke about COVID, I think I'm going to ask you about how Medanta has sort of, what have you done? Tell me about how the COVID management at Medanta.
So, like with everybody around the world, this was a new thing that hit us early part of this year. And our first interaction with COVID actually was when the government reached out to us to say if we could look after these 14 Italian tourists who had contracted COVID, and while they were on a group tour. And the government requested that they get brought into Medanta and get treated by us. Which we were able to do successfully, and we were able to treat those patients. So that was our first kind of exposure to it. I'm sorry?
Which month was this?
I think this was around February when this happened, shortly before all the lockdown type of activity started. Yeah. So there was a group of tourists. We brought them in, we treated them. Obviously, there was a lot of complications for us, not only in terms of understanding COVID because it was a new disease for the world, but also in terms of language. Their families were in Italy, so trying to explain to families what was going on between the doctors and the nurses, between the patients and the doctors. So there was all this kind of challenges which we faced. But we were able to overcome it. The doctors and nurses at Medanta really rose to the occasion. It was a new thing for everybody. We created an isolation ward for all of them. And then slowly we started to see cases rising in the countries, cases rising in Delhi, in Gurgaon, and people started to say, where do we admit these patients? We actually spent a lot of time with a couple of other private hospitals and the Gurgaon government and volunteers who were actually able to raise money to actually try to create extra capacity, because we had heard all these stories from the West that there are patients being treated on the street and that hospitals are getting overrun. So we were actually looking for a facility which we could partner with the government and with other private players and put up maybe a 500-bed COVID facility in Gurgaon, which would be dedicated for COVID. Now, we weren't able to get 500 beds, but we were able to get about 150, 200 beds in one of the private hospitals, which Medanta and a couple of the other private hospitals came together to actually put the medical staff into place. We upgraded the infrastructure of that facility and actually were able to admit, the first set of COVID patients in that facility, and our doctors and doctors from other hospitals would go there and look after them, etc. And then as the volume started to surge, obviously all the hospitals started to get, demand for COVID patients. And so Medanta as well, we started to get patients. And this was still early days in terms of treatment protocols. There was a lot of debate going on about what kind of treatment and therapy. This was even before you had all these experimental drugs like remdesivir and others, which were actually not even available in the market at that time. So, the doctors, with the help of their colleagues across India, with the help of colleagues across the world, actually started to get up-to-date protocol. Whether we should be using hydroxychloroquine, remdesivir, other experimental theories, get all of this kind of into place and started actually treating patients both in the ward as well as in the ICU. And we started to realize that depending on what the condition of the patient was, doctors were able to find that early intervention in many cases actually had very significant improvements in terms of the mortality of the patients or in terms of the seriousness of the patient. So our doctors really were very, very quick to adapt to all of this stuff and get ahead of the challenges. So we never really felt overwhelmed in the institution in terms of the actual treatment. Of course, the numbers were swelling across Delhi NCR at the time. So that was kind of the first phase. And we kind of got through that. We had over 250 patients admitted. I mean, over that period of time, we must have treated, several hundreds of patients, discharged most of them successfully, were able to keep the mortalities down to what the global standards were. In fact, even better than the global standards at that point in time. There's a lot of theory about the fact that the Indian gene pool may be benefiting, or we are a younger population, etc., etc. All theories, none of it really proven. But we were able to kind of get through that phase, and we started to see the numbers actually dip in Delhi NCR region. And we actually realized that, okay, there was a time when things seemed to be starting to get better. The numbers were falling, recovery rates were better. And we were actually able to, discharge all the patients who had COVID. So there was a couple of weeks, maybe about, 3-4 weeks, where we actually didn't have any COVID patients in the hospital. And even the other hospitals around the region started to see a reduction of numbers. So there was this big clamoring for bed availability at some point, and then it became cool. And that was the time when other parts of India actually started to explode. So, we found that in the south and early on, the numbers were down, and the north, the numbers were rising. And now you started to see the south, actually, the numbers started to increase. And we started to see cities like Bangalore, even, Chennai, in Andhra, in Kerala, etc. Various places, the numbers started to rise. And, we had a sense that, maybe a second surge was coming. Also, what we were able to do is get more confident in how to manage home care. So we have a fairly aggressive home management program. We have treated hundreds of patients where we just monitor them remotely from home, and a doctor will call them every 2-3 days, a nurse calls them every day. So we've got a Medanta home care program. And we also tied up with one of the hotels. So we said that, look, to save the hospital capacity for really sick patients, there would be people who are not that sick, but they don't have the ability to isolate at home. So we tied up with one of the hotels in Gurgaon. We took 150 beds and we actually managed that hotel.
See, one of the things that we've seen because of COVID and the lockdown is the rise of health tech. I want your views on that.
I've been a big proponent of health tech for a very long time, much before COVID. And I think that the journey for health tech has been on for some period of time. In fact, in some ways, the technology has been here already. And it's really just the patients and the doctors and the caregivers that need to get their mindsets around the use of the technology. So telemedicine is what most people talk about, but that's not the only thing in health tech, and that's not the only thing in care, so it takes more than just a teleconsultation to actually think about care. So you have to think about the whole spectrum of healthcare. So whether it's remote connectivity, whether it is wearable devices, whether it is artificial intelligence algorithms, or even if it's simple stuff like how do I actually navigate a hospital using apps, using payment mechanisms in terms of the patient experience or the patient journey, or even stuff like patient awareness. Right? So how do you educate a patient, say, for example, what is the correct option for me? Should I go for bypass surgery or should I go for a coronary stent? Many times this is information people want to know. So this entire concept around patient awareness, patient empowerment is also something that tech can help with. And this has been on for a long period of time. And Medanta has been doing teleconsultations for the last many, many years. And we've had great amount of success with it from people all around the world. What's definitely happened is that those numbers have gone up, maybe 10 or 20 times. So if you were doing, maybe 10 consultations a day, now you're doing 100 consultations a day. So our numbers have exploded in terms of teleconsultations, and I'm sure that's a broad trend. Now, what I feel is that the pandemic has actually forced people to understand that this is a viable way of delivering care. They have forced people to innovate in terms of the ways in which they think that they should be delivering care. And so what they've been able to do is technologies that for the most part existed before COVID have now started getting adopted. And earlier there was hesitation to adopt them. Now they've actually started getting adopted. So we at Medanta are running now executive health check program at home. So somebody will go home. We've got, devices that will take your ECG at home. We've got devices that you can actually get a large part of the care done at home. You can do teleconsultations. You can do a lot of diagnostics now at home. So a lot of this stuff will happen. And you're also going to get with the wearable industry growing, you will get people being able to self-monitor and actually call in ahead of time to the doctor and say, look, these are my parameters, and maybe we can intervene at an earlier point in time. So just imagine a patient who has hypertension. Instead of coming in when their blood pressure is already out of control and being in a much more critical situation, we actually can, with the benefit of home monitoring, say, look, we're taking your blood pressure twice a day. We're actually monitoring what's happening. And we're actually being able to say, this is what needs to happen in terms of early intervention so you don't become very sick. So I think this is going to be a game changer. I caution that just looking at it in isolation is not the right way to think about it, right? So just telemedicine or teleconsultation is not how you bring in care, or just artificial intelligence is not how you bring in care. The real value in this is going to be how do you link the digital and the online world with the offline care, right? And look, all healthcare at the end of the day requires a patient and a caregiver, most cases a doctor. You need to make sure that you don't break that trust relationship, right? So as long as we are using technology to further enhance that, I think it will be huge. And a country like India's, we have no choice but to, embrace this.
So this is a trend that you think is here to stay and it's only going to grow. What are the other trends that you feel that have sort of come out now, especially now the last few months of, the lockdown and COVID?
So one of the big things that I think has come out in healthcare is actually how you think about how you're actually going to deliver the entire patient journey, but deliver it broken up parts rather than in one comprehensive unit. So I'll explain what I mean. Earlier, what would happen is a patient would come in to the hospital, get admitted, get the entire range of their treatment, whether it is medical or surgical or whatever, then, get discharged and go home. And basically the entire intervention of care would be complete in the hospital. I think now what you may start to see is that you may actually disaggregate this. You may actually break this up across different parts. So you may have some elements of this get delivered, let's say, at home before the patient is admitted, or maybe in a primary care clinic closer to the patient's home. And you do a whole bunch of investigations. Maybe you do pre-operative investigations. You do that whole checkup. You're virtually connected into your surgeon. You come into the hospital. By the time you come into the hospital, the doctor already knows, most of the things about you. Maybe they do a couple of your final checks. You get your surgery, and maybe very quickly you will be good enough to go home. But at home, you'll be looked after in a different way. So you will have people go to your home, you'll do post-operative follow-up visits, you'll do physiotherapy at home, you'll have constant monitoring, maybe with remote devices or wearable devices. And what this will do is it will reduce the cost burden for the patients, and it will free up the hospital infrastructure to actually look after the people who really need to be in the hospital. So I think that's kind of one aspect that will change. I think the second aspect that will change is that you will start to think of giving the patient more power during the course of their care journey. And that would be helping navigate the hospital, giving them information on stuff like apps, explaining to them what's happening at every stage of the journey just by updating them, as well as empowering them to be able to say, look, you tell us how you're feeling. You record the number of steps that you've done. You record what your symptoms are right now. And as you enter this information in your smartphone, it's actually calibrating this at the back end through a computer algorithm and raising alerts proactively to the doctor. So it is actually proactive health monitoring. And that will eventually shift to real health monitoring rather than disease management. So let's say I'm a healthy individual, I don't have any complaints today. Well, how do you monitor me over the course of the year to make sure I remain healthy, rather than when I actually fall sick, then I come into the doctor saying, doctor, please cure me. So you can start to track things like nutrition, diet. There's a lot of stuff going on around, all the various microbiomes and all the various types of biomes that are there in the body. All this data will then start to get analyzed by artificial intelligence engines and hopefully actually direct you towards a healthier life rather than lead you a place where you end up with a health intervention. So that's kind of what I see. I mean, different parts will take, different amounts of time. And unfortunately, healthcare has typically been slow to adapt to change. So maybe this pandemic will force us to put our foot on the accelerator a little bit. But I personally believe that the way it's been done in the past is over, and we will find a new way of how we actually think about healthcare. And I hope that we do, actually, because we need to change the way in which we think about healthcare and healthcare delivery.